everyone. World Heart Day. What is World Heart Day? Actually, why is World Heart Day celebrated? World Heart Day is celebrated on September 29th every year. On September 29, 1999, the World Heart Federation established World Heart Day to raise awareness about the cardiovascular diseases, that is, including heart disease and stroke, as the world's leading cause of death. All about human heart. The heart is a muscular organ about the size of a fist. It is located just behind and slightly left to the breastbone. The heart pumps blood through the network of arteries and veins called the cardiovascular system. Coming to the chambers of heart, the heart has 4 chambers. The right atrium, it receives blood from the veins and pumps it to the right ventricle. The right ventricle, it receives blood from the right atrium and it pumps it to the lungs where it is loaded with oxygen. The left atrium, it receives oxygenated blood from lungs and pumps it to the left ventricle. The left ventricle, it is the strongest chamber. It pumps oxygen-rich blood to rest of the body via the aorta. So, the left ventricle's vigorous contractions create our blood pressure. The coronary arteries run along the surface of heart and provide oxygen-rich blood to the heart muscle. A web of nerve tissue, it also runs through the heart. What it does, it conducts the complex signals that govern contraction and relaxation. Now you can see pericardium. What is pericardium? It is the surrounding of the heart. The heart is surrounded by a sac called pericardium. Coming to the functions of human heart pumps oxygenated blood to other body parts. It pumps hormones and other vital substances to different parts of the body. It receives deoxygenated blood and carries metabolic waste products from the body and pumps it to the lungs for oxygenation. It maintains the blood pressure. If heart is doing all these functions, I have just precisely said about 4 main functions. There are more of the functions, okay? If heart is doing such functions, then it is obvious that it will be affected with certain diseases. So let us see that. Coronary artery disease. Over the years, cholesterol plaques can narrow the arteries supplying the blood to the heart. The narrowed arteries are at high risk for complete blockage from a sudden blood clot. So this blood clot can lead to heart attack. Coming to angina pectoris, it is nothing but the narrowed coronary arteries. They cause predictable chest pain or discomfort with exertion. The blockages prevent the heart from receiving the extra oxygen which is needed for strenuous activity. That is all about stable angina pectoris. Coming to unstable angina pectoris, chest pain or discomfort, it will be new, that is worsening, or it even occurs when the person is at rest. So this is an emergency situation and it can precede a heart attack, serious abnormal heart rhythm, or cardiac arrest. Coming to this myocardial infarction, nothing but heart attack. A coronary artery is suddenly blocked. Because of that area is starved of oxygen, part of heart muscle dies. Arrhythmia, an abnormal heart rhythm due to changes in conduction of the electrical impulses through the heart. What is congestive heart failure? The heart is either too weak or too stiff to effectively pump blood through the body. Cardiomyopathy. It is a disease of heart muscle in which the heart is abnormally enlarged, thickened, or stiffened. Because of that, heart's ability to pump blood is weakened. Myocarditis. It is nothing but the inflammation of heart muscle, the middle layer of heart. It is most often due to viral infection. Pericarditis is the inflammation of the pericardial layer, the outermost layer. pericardial effusion, atrial fibrillation, pulmonary embolism, heart valve disease. Coming to heart murmur, what is that? It is an abnormal heart sound which is heard while listening to the heart with a stethoscope. Some of the heart murmurs are benign, others will be suggestive of heart disease. What is mitral valve prolapse? The mitral valve is forced backward. Where is it present actually? It is present between the left atrium and left ventricle. So it is forced backward, that is slightly after the blood has passed through the valve. What is sudden cardiac death? Death caused by sudden loss of heart function. Sudden loss of heart function. It can lead to cardiac arrest. Now, what is cardiac arrest? Cardiac arrest is nothing but it is the sudden loss of heart function. Now, coming to the common symptoms of a weakened heart, that is chest pain, shortness of breath, swelling in legs, ankle and feet, fatigue, palpitation, persistent coughing or wheezing with white or pink blood tinged mucus. There are many more. I have just said a few here. What are the indicators of a healthy heart? That is heart rate. For most adults, a normal resting heart rate, it ranges between 60 and 100 beats per minute. Physical activity and exercise increase your heart rate, while stress, activity, anxiety levels, and medication, it can also affect your resting heart rate. So the easiest way to tell how fast your heart is beating is by feeling your pulse. Coming to blood pressure, for a healthy heart, blood pressure is usually below 120 millimeter of mercury in systolic pressure and 80 millimeter of mercury in diastolic pressure. So if your systolic pressure is at 130, or you can say higher, or your diastolic pressure it gets to 90 or above, then it is considered to be elevated. Quick recovery rate, that is heart rate recovery, is a measure of change in your heart rate after you have stopped a workout or another high intensity activity. Fine. So these were the indicators of a healthy heart. Coming to the method of diagnosing heart diseases, that is electrocardiogram, Holter monitoring, echocardiogram, exercise test or stress test, cardiac catheterization, heart, that is CT scan, MRI scan, you can tell it as magnetic resonance imaging scan of heart. Now coming to the dietary and lifestyle changes. Till now we saw the symptoms, the diseases, the functions of heart. Now what we need to do to prevent all these, that we are gonna see. Don't smoke, eat healthy foods, control blood pressure, get a heart healthy diet, get a cholesterol test, manage diabetes, exercise, maintain a healthy weight, manage stress. How do you manage stress? Like you can get help from support groups, or you can connect with friends and family or a support group, which is a very good way to reduce stress. You may find that talking about your concerns with others in similar situations, it can help. And practice very good hygiene, practice good sleep habits. Hope you all enjoyed this session. Thanks for watching. Stay tuned for our latest updates.